Welcome to yet another episode of Thursday Thought Leaders with Harvinder Narula on BW Healthcare World. My guest today is Dr. Nitish Shetty. He's the CEO of Aster DM Healthcare in India. Dr. Shetty has a vision to enhance medical accessibility and leadership embodies, and his leadership embodies innovation and compassion, driving transformative healthcare solutions for communities in a need. He joined Aster Group in 2014 as the CEO of Aster Hospital in Bengaluru and then took charge as a regional director for Aster Hospitals in Karnataka and Maharashtra, and recently took over as a managing director of Aster Healthcare India. Let's speak to Dr. Nitish about what the plans of the hospital are post the separation of its GCC segment from the listed entity of Aster DM. Welcome, Dr. Nitish Shetty, to BW Healthcare World. Dr. Nitish, you have managed hospitals as a medical superintendent earlier in your career, and now you are a CEO of a chain of hospitals. How has the role and the priorities evolved in your journey?
Yeah, of course. You mentioned I was a medical superintendent running a hospital there. There, the priority was taking care of day-to-day activity and ensuring patients, doctors, all the people involved in delivering the healthcare are comfortable, and we measure up to the expectation of all the stakeholders in that particular area. But now I have a larger role to play, but still the focus is the same: patient-centric care, quality care, ensure the ecosystem is perfect for what to the expectation of our stakeholders. At the same time, it has to be done at a larger scale across many geographies. The challenges are at a different level because though healthcare is the same everywhere, but dynamics are different, entirely different. What we do in Kerala to deliver the quality healthcare, what we need to do there is a little different at a higher level, not at the basic level. The patient lying on the bed gets the same experience wherever he is. But to manage the ecosystem is a little different. We need to understand the local culture, local nuances. Healthcare is a very sensitive matter, sensitive subject. We can't subject it to our own idiosyncrasies, saying that this is how we function, this is how it should work. We need to respect the local nuances. It's a very sensitive matter. So in that way, we understand that because we are in many states, and good for me is I have got kind of insight of where the hospitals are managed across countries. It's because we had presence in 7 to 8 countries when we were part of the larger entity. So that is more, give more emphasis whether managing the employees, managing the patient, the local culture, and we need to respect that aspect. Also, we are a corporate, this is how we standardize, this is how it should be. No, we don't believe in that. We need to accustom us to the local requirement, but at the same time, the quality of care and standard should be same across. That's a challenge we are constantly working on. With our years of experience, being part of day in and day out, anything you do day in and day out, you become good at it. But there is always room for improvement. This is a constant endeavor. You can't be happy with what you're doing because a lot more needs to be done. Every day is a new day and different challenges there always. So in that sense, it's the same work exaggerated to the next level, but as you expand and grow further, you have to ensure that what you're known for, the integrity of yours as an individual, as an administrator.
I think you have to become relevant to the area that you're serving.
Obviously, that is very important. And India is, though we have so many states, we have many countries within one country, right? So in that sense, anybody who runs our healthcare in India is very, very well equipped to manage anywhere in the world.
Got it. And Dr. Shetty, hospitals work very different from corporates. Usually it's the CEO who calls the shots, and the chairperson of departments and HODs in a hospital have a lot of influence in decision making in a hospital. They influence the equipment that needs to be bought, the therapies that need to be done, the technologies that the hospital must adopt. They impact the decision. Now, as a leader in the healthcare industry, how do you balance uh, and prioritize the need from an administrative point of view, because at the end of the day you're also responsible for sustainability of the hospital that you have set up financially, and also manage the best quality based on the recommendations coming from the chairpersons of the departments. And you being a doctor yourself, is it helping you and do it better than a hospital that does not have a doctor managing the administration?
Yeah, yeah. I mean, this is something which is a very good question. If you are to ask me, it's very relevant. See, healthcare has gone under evolution because it used to be hospital used to be a charitable hospital, a government hospital, not for profit. Then came the profit hospital. Then that came the corporate hospital. All this last 20 years, there has been kind of when a doctor joins, he's not bothered what you are. He's there to join, do his profession. He has a gastroenterologist joins you as a gastroenterologist. He doesn't bother to find out who you are, as long as his requirements are met and he's able to take care of his patients. There's no clarity about it. Can be not for profit. Some were confused. Are they profit, not for profit? So nobody bothered what you are, what you stand for. And obviously, people like for not for profit because that was the agenda of the healthcare, that you can't make money on the healthcare. You need to provide service. But over a period of time, that has changed, like, because the doctors are the most intelligent of the lot, because the best of the people get in to become a doctor, the most intelligent, the top rankers, and they're putting their blood and sweat into this profession, dedication, and then when his skill has to be, you see, a private hospital, a for-profit hospital, you are leveraging on his skill. You need to monetize his skill. So he is very clear how much you can use it for your organization purpose and how much for his purpose and his patient purpose. And all doctors are very clear. It was earlier it was a kind of relation between doctor and the patient. It is me and you. It's give and take. I'll take care of you. This is what I need to be compensated, and that is within his control how much he can charge, how much he can. But with the corporate coming in, this is taken away from him, and he's not very sure how much you are charging the patient and why are you charging the patient. This conflict was there. So now, in the last 20 years, all hospitals have become private, and most of them are now private also. What you stand for? Some people even said that we are a private hospital, but we are not here to make money.
Right.
You have to serve the public. So there was a confusion. See, what doctor needs is a clear communication, what we stand for, and be mindful of that. His priority is his patient. Because without patient, he doesn't exist. You can't take away that part.
Right.
If you are very clear that we are here to it's like you mentioned, Dr. Dev mentioned triangle. It's a triangle between you, me, and the patient.
Correct.
What is there for us? What we stand for? Why we are here? What we can do? And what we are expecting from you to do? And we also would like to know what you expect from us. Let's have a clarity in this. Because if I tell him I'm not here to make profit, you serve the patient, but on the slide I'm saying that I need profitability, he won't like it.
Right.
Today somebody is joining us, they know you're a listed entity. You have to express what is the expectation. You can't keep away that part. You need to be open, because as a doctor, they consider me as a part of their fraternity. They won't consider me as a businessman, because I also happen to be a doctor. But when I sit with them and tell them, look, this is a listed entity. There are stakeholders. This is done for a reason. And what we do needs a lot of money. And somebody gives money, we need to ensure that we also have to give them returns. It's in the larger interest of everybody here. You, me, patient, let's keep it transparent. There's nothing to hide. Right. So as long as what you do, what you are doing, how we are doing it, we are going to tell. And then what is expected from us also, I communicate to our doctors. Nothing is hidden from them.
Right.
Because now it has come to such a stage, most of the healthcare entities are listed. So when you are listed, the objective of you need to take care of a shareholder's expectation is very clearly defined. So
Right.
doctors also understand that as long as you keep that part very clear, of course, there will be rift of how do you prioritize him or the other departments. There is competition within the department, between the departments to keep everybody. But lately, most of the doctors are aligned. When you keep the communication very clear,
Got it.
very, very clear, and then never say you can't collude with the doctor and say we'll take care of an advantage of a patient. It will never work in the
Right.
long run because I still believe majority of the doctors are still true to their patient because
Absolutely.
they know through their education, through their learning the skill, how important is a patient. So if somebody thinks he can disconnect the doctor from the patient, not good.
It's not in the best interest of serving the community. I mean, that's the purpose of the healthcare business at the first level. And Dr. Shetty, since we are talking about the business aspect of running the hospital, expansion and growth are often the objectives of any business. Now, could you share Aster DM's Healthcare's approach to this strategic expansion, both geographically and in terms of service offerings? I mean, we know that the Aster DM as an entity, the GCC business got separated. What will be the key areas of expansion in India by the listed entity? Will there be an investment in hospitals along with expansion of existing hospitals? Would some M&A be a part of this expansion plan? Could you share some insights?
Yeah, definitely. One thing about the Aster model, I would like to kind of share with you what made us successful in the last 10 years is we have been a late entrant into the Indian healthcare market. We have been very active in the last 10 years. It has advantage and this has disadvantage also because people have a head start over us. Competition has a head start. But what we have as an advantage was to learn from the incumbents, the mistakes, the gaps. What worked for them, what didn't work for them. So we had that luxury of understanding how to address those challenges. So one thing we were very clear is, see, the healthcare is more of a word of mouth and reference. Still, unless otherwise we get no. You see, even the doctor, his practice is more of referrals and word of mouth. So we need to create that ecosystem wherever we are. We can't be a fringe player, a one hospital among many above hospital. You will not get that recognition. You will not have talent associating with you. And also you will not get that referral and word of mouth. So wherever you are, you need to be a dominant player. Because the Indian market is so huge and so deep, you have enough there to create this ecosystem. So, for example, in Kerala, we are the dominant player in excess of 2016. We are closing to 3,000 beds now. The second largest player is way off around 1,200 beds. So we have every 200 kilometers, we are going to have a hospital. So we have a cluster approach. We have many, many hospitals in the same geography. It's not about do we need to have a hospital, are we going to serve the population, but we need to strategically place ourselves wherever you go, we should be visible.
Right.
So
right.
cluster. So this helps. See, doctors want to associate with the leaders who are growing, who are dominant, and who have better word of mouth and visibility. So by being we had an option of having 4 hospitals in Kerala, 4 in Delhi, 2 in Agartala, 1 in. So we didn't do that. We didn't go and spread ourselves thin because we just wanted to have a token presence. We said we'll explore the length and depth of the market. So we did it in Kerala. In Bangalore, in less than 7 years, we have put more than 1,000 beds. In spite of having a cluttered presence, so many competition was there. We started a hospital called CMI, launched the hospital. Next day, when we launched the hospital, within a week, we had closed another hospital. People are asking, you are not even started. What gives you a confidence to start another hospital? You have to see this hospital succeeds, then go ahead. I said, time has gone where you have to go and test the market. If you don't know that much, because there's so much of demand and supply mismatch in the city, you need to create that. You need to give what patient wants. Bangalore has become a city within city, so many areas. North Bangalore, people will not travel to South Bangalore. You can't sit at your place and say, all of you come to me. It doesn't work that way. So we put up three hospitals and we are planning more. So in that sense, cluster approach of ours in Kerala, Karnataka, Maharashtra, has helped us in that context. So that's why we are creating 19 hospitals, close to 5,000 beds. Now we have plans to further expand in the same geography, add another 1,700 beds in next 3 years. And in that also, it is more of, see, we are a listed entity. We need to bring in more margins also. We can't spread ourselves thin, put up only new projects and lose the margins. When you start new hospital, it will lose money for few months, a year and a half, 2 years. So we are a listed entity. We are answerable. In that context, we need to strategically expand. So what we are doing is 60% of those beds, 1,700 beds, which we are planning to deploy, are going to be brownfield expansion, meaning to say existing hospital, we are adding more beds because most of the hospitals have reached max capacity. And some hospitals are at 70% capacity. We are not waiting for that to go to 80 and add. We are already, because it takes 2 years, 2.5 years. Because what has helped in healthcare, one thing is very clear now. Tomorrow is not an extension of history. It's entirely different. So you need to be up there. Like I said, we need to consider what is going to come tomorrow. We need to adapt to that and deploy. So we have deploying 1,700. But having said that, this is which we are declared officially because as a listed company, we can't talk about things which we are not formalized and cleared by the board. This is what we have mandated, and this 1,700 bed is out in the open. But as I am speaking, we are also exploring expanding to the neighboring states like Tamil Nadu, Maharashtra, further into the deeper neighboring markets. But that will be officially communicating when we formalize and everything is clear from the board. And also we are looking at UP market, which is new thing which is happening because that's a large state. Things have changed lately with the government initiatives. The state is doing well and there's a big opportunity there. We are also looking at that. But again, this organic growth of 1,700 beds, inorganic, we are also looking at merger and acquisition also. And we are very particular about the model should be something similar like us, where somebody who's has a cluster presence, they are dominant players in that geography. Because we don't want to be a fringe player wherever we are. Tomorrow, we're in Maharashtra, we have to be among the top three. Even in the country, we have aspiration to be among top three. We don't want to be on the wayside. Because believe me, either you are there or you're not there. Being in healthcare in the peripheries or in the sidelines doesn't make any sense.
Right. And Dr. Shetty, I know that setting up expanding and putting extra additional beds costs a lot of money, whether it is expansion within your existing hospital or through an M&A, buying out, acquiring other smaller hospitals and expanding them. What is the kind of budget earmarked by the Indian entity to expand in different geographies as well?
See, for this 1,700, we have earmarked 1,000 crores. That funding is going to come from internal accruals. We have enough cash generated because most of the hospitals are maturing. We have enough cash to fund that. We don't have to over leverage our balance sheet to fund this 1,700 expansion. But when it comes to inorganic, we need a larger fund for that. Lately with the segregation, our share price has corrected. We will be using our share price as a currency if there is an opportunity. Or there is some amount of which the board will decide subsequently, because I'm not supposed to talk on something which is not cleared by the board. Some sale proceeds can be used to make an acquisition. There are two options: leveraging on a share price or using the sale proceeds also. We are open to that because we know we don't have luxury of time to go there to become among the top three, because you know how fast the market is getting consolidated. We need to act fast. So everything is within the 5 years we have planned. Our presence has to be bigger than present what we are to be competitive and continue furthering our model.
And Dr. Shetty, I know you and me were talking about the challenges around hiring and retention. You as Aster DM have been looking at certain markets where there are other chains as well. Second is you're moving towards tier 2 and also eyeing tier 3 in the future. You know, these are areas where it's difficult to have experienced doctors move in. And also the challenges beyond the doctor. I mean, if you look at the nursing staff, worldwide, there is a need, a growing need for nurses, and India seems to be the feeder market for these nurses, which is creating a challenge of experienced nurses within the country as well. How, as an hospital administrator, are you managing this challenge, and how have you been seeing success in the past?
Yeah, this is the industry problem. Nursing attrition, it's a major concern. Of course, we are serving the most of the Western countries. Most of our nurses wants to get trained in the large facilities of ours and go abroad. One thing which is helping us is the clustered approach what we have. We have thick presence in the geography where we are. So the management bandwidth in terms of attracting talents, retaining within that ecosystem is much easier. Like in Kerala, it is much easier in Bangalore because you have one hospital in one geography, you might struggle a lot. I'm saying it's not a solution for this attrition, but to large extent it mitigates. One of those clustered approach of ours helps in retaining the talent within the ecosystem. We move them around within the ecosystem. It helps to a certain extent. And then, we are inherently have an advantage of being a Kerala-based group in terms of, 60% of Indian nurses come from Kerala. And the paramedicals come from Kerala. So in that sense, we have better access to those nurses there. And the aspiration of the nurses is to go to GCC or US, UK. So we have kind of a system where we give a career path if somebody aspires to go to GCC. We have been doing it earlier also. Now we have kind of an arrangement with a GCC counterpart that some nurse from within the system wants to aspire to go to GCC. It's not only about going to GCC, but also someone to come back after some time. Now, when they come back, what is the assurance? So the whole piece is taken care of in our system, where if somebody wants to go abroad, because we know if not our sister concern hospital there, they will go to some other hospital. You can't stop it because they are in demand. So, but they go through us, to our sister concern hospital, and then they want to come back later. They don't have to worry about it. There is an assurance. If you're coming back, we'll accommodate in our hospitals. So we are using these strategies, and we have inherent advantage. I have to accept that. That does make us more aggressive in this context. But I had to be very true here that we are not sorted out this problem entirely. We do face this challenge, but that's where we are trying to see. We need government help also. See, a typical nurse does what? A nurse's job is right from bed making, taking care of the patient's hygiene, to giving medication, to give a lot of stuff, what a little bit of doctor's work also they do. But our thing is, why shouldn't another category should be doing the mundane job what is not statutorily required by a nurse to do? Bed making, bathing the patients, taking care of the work which is not statutory requirement by the nurse. We are creating another cadre to take care so that a nurse who can take care of 2 patients can take care of 4 patients with this category of people 10 plus who are trained. So we are creating that system where called nursing aides who help the nurses in taking care of the patients, and they do 30 to 40% of the routine nursing work and leave them to do that core job of nursing, which is statutory requirement. So we have come up with various, we Indians specialize in addressing this requirement. So in that context, we are able, but work in progress. We are also trying to use innovations, technology sometimes, like your centralized monitoring, call system, so many things which burdens the nurse with a lot of work. We can use the precious resource of nurses to maximize the potential. Technology, innovation in the way we design their work also, and then also how we recruit and retain them. It's many things playing at a time.
And Dr. Shetty, you mentioned technology. With a cluster of hospitals and the number of hospitals that you have, I think you have 19 hospitals right now?
19 hospitals.
In 19 hospitals, I'm sure there's a lot of data getting generated. The patient data, the data of the pharma usage, the outcomes of the diagnostics that are happening. Now, one is, how do you use technology to your advantage? What are your thoughts on interoperability? Because, as a patient, I don't see too much of benefit to me when the hospital is building this data. It, for me, it will be beneficial if my data is shared with other hospitals, so that if for any need I am going to another hospital, they already know my background, what has happened with me, what are the diseases or conditions I'm challenged with right now, so that appropriate care is given to me. So how are you using technology? What are your thoughts on interoperability? And last, since there's so much of data being generated, you also have the responsibility of ensuring the safety of this data. So what are you doing about this?
Yeah, that's to answer your last question first. The security part, that's a bigger concern now. Because everybody is doing the digital path and everything is atomized. There's a lot of investment we have to make in that space for data security, ensuring backup of this data. There are certain expenses which were earlier we never used to factor in terms of IT expenses, which were always considered negligible. But like when you do a budgeting, we look at the biomedical equipment, that is the equipment required to treat patients and day-to-day functioning in the hospital. We are almost now giving the same weightage to this piece of the IT requirements, whether it's a server requirements or the safety measures, fail-free mechanism, which is not one time, it is constant. So we are there in terms of maintaining the standards. What are the government mandated statutory requirements we adhere to, like to adhere to the fire license and pollution control board license. We ensure that we adhere to the new rules are coming from the data privacy and protection. We are adhering to that. We are investing on that piece. Definitely, we are doing it. Now, data is new oil, right? It's like oil. It is a huge potential. Now, we are also working on various ways, because just having data is not enough. The data should make sense to somebody eventually if it has to be monetized. There is an opportunity to do that. We have a team working on that to ensure that from the time of data collection to kind of scrubbing it and sanitizing it and collecting it, making it relevant to the whoever wants to use it. But again, adhering to the guidelines of the safety, privacy issues, we have to cater to that. This is for a long haul. It's not for immediate monetization. We know the value of the data, but we need to put the basic structure in place, because that data is not of, now we have crude oil. We don't have oil which can be put to use. But I feel going forward with the interoperability, what is going to happen through insurance companies are going to mandate it. And Ayushman Bharat Digital Initiative also going to kind of bring in the interoperability. With that, the value of unlocking of this data will be huge. Now, who is going to do it? Either we are going to get a part of it, or government is going to regulate it, or insurance companies are going to prioritize. This is something we need to decide in the future. But our job at right now is mining and keeping it in the sanitable piece so that it will be of value tomorrow. Don't consider it as just a number, but see, look at it as a currency for a future, because we need to use all those options to reduce the cost to the patient.
And absolutely. And Dr. Shetty, my next two questions are about you. It's a very, very sensitive and a responsible job that you have, especially when you are running a healthcare delivery institution, but as a listed entity. There's a pressure to manage the outcomes. There's a pressure to keep yourself updated with the most modern equipment. And we know that the equipments need an update quicker than what we've seen in the past. But there's also a regulation that you have to maintain, compliances. How does this scenario affect the decision making compared to someone who's running a healthcare institution, which is not a listed entity?
Yeah, definitely. Because you are a listed entity, you have more responsibility to maintain the compliance. It might slow down your agility in terms of making decisions, because we need to every decision has to run through a process. But in the long run, I feel that's the only way. you will scale up. It will enable you to scale up, but we can't be looking at, but at the same time, we should be mindful. Decision is all, you need to make a timely decision. You can't afford to fall back upon the regulations so that you don't have a luxury of saying that, no, I have to get it cleared, wait. No, there is no, but we need to be mindful. It's a delicate balance, but adhering to the guidelines, governance is very important. If you don't do that, you can't, if you have an aspiration to be a top three in the country, you can't compromise on those aspects. Definitely, you can't compromise. You have to accept it as a part of the running the business, go through the system at the same time, be agile at the same time. So it's a responsibility which comes with the responsibility, with the huge accountability, also responsibility. You know that you have to, that is also sometimes frustrates the doctor saying that why is it, but it is our job. That's like I said, communication is very important. Transparency is very important. Doctors are not uneducated people. They are highly intelligent people. And when they know certain things are done for their own good and their patients' good, they'll never be difficult.
Dr. Nitish, my last question to you before I let you go is, what are your thoughts, since you're now going to be expanding the hospital and you're also going to be having an inorganic growth by acquiring other hospitals as and when you do that? What is your personal belief in building sustainable hospitals, and what is it that you think you are already doing to ensure greener and environmental friendly hospitals in the country?
Yes, see, this ESG has been very helpful. We have taken it very seriously, ESG part. So we, in fact, Aster was ranked among the top 100 in the world for the ESG guidelines. We scored more than 7% points. So in that sense, we are very much focused on this because it's a mandate from the board itself. Whether sustainable is very important, green energy. Most of our hospitals are now in the renewable energy. We have whatever the government provides for and what we can do on like solar power, whether in Kerala or in Bangalore, we have deployed across all our units. That renewable green energy, especially solar, we are focused on that, and most of our hospitals are running on it. And newer hospitals also enable for the solar power because we know that is the need of the hour. Another hospitals are also water intensive. They use a lot of water, recycling of the water, the usage of wastage of water. We are very focused on that to avoid that. Whatever needs to be done to reduce the carbon footprint, we are also considered as an industry. We also have a responsibility in that sense. So we are focused in that, and we already have been ranked among the top 100. That puts enormous pressure on us also to ensure that we continue doing that in that aspect, ESG aspect, continuously. And we are at it. And also, apart from that, we have other volunteer work, so many things which it is a part of us being a large group. We do those initiatives, but that is a different piece. But when it comes to ESG, definitely we are focused on this. That's and we have a reputation to protect now.
Awesome. Dr. Nitish, it has been such a wonderful conversation. I did not know it will go so long, but it was very, very interesting speaking to you. And, some of the things that, I realized what Aster is doing is especially keeping in mind that the geography that we are operating in, that is India, we have social and economic scenarios to serve. We have societal influences which could change from one region to another. We have community and cultural concerns that you are addressing while ensuring the corporate responsibility of the shareholder responsibility to make it sustainable business, and yet managing the patients in a way so that they all get same quality of care, but managed differently in different geographies. That's a beautiful work that you are doing at Aster DM, and look forward to speak to you more often, and all the best.
Yeah, it was a pleasure talking to you, and thanks for having me on your show. And look forward to connecting with you again. I enjoyed the discussion, and hope in the future we get an opportunity to discuss further the progress we have made. But we would also like to learn from you. You are a veteran in healthcare. You get a better perspective than us because we are working within our confinements, but you have the vision that I say opportunity and the luxury of interacting with all the thought leaders. So I would love to learn from you now.
Look forward to see you soon, sir, in person.
Thank you.